The Brain, Diving into Spatial Attention in ADHD by Brian Scanlon, Jimena Tapia, Frida Jimenez, and Sabrina James. For today's agenda, we'll be discussing what is ADHD, interactions between attention and working memory in adults with ADHD. We'll be presenting some visual aids and final tips and takeaways. Today, I'll be discussing a small overview regarding ADHD. What is ADHD? Well, ADHD, or also known as Attention Deficient Hyperactivity Disorder, is a developmental disorder that affects people of all ages. Often diagnosed in childhood, but can also be diagnosed in adulthood, people with ADHD have different brain structures in the prefrontal cortex, basal ganglia, and the cerebellum. Lower levels of dopamine in individuals with ADHD lead to difficulty maintaining motivation and focusing. Symptoms include attention deficiency, impulsiveness, and inner restlessness, and many other symptoms. These symptoms tend to persist into adulthood, impacting daily and professional lives. ADHD affects academic achievements, work performances, and personal relationships. Treatments options include medication and behavioral therapy. ADHD symptoms and their definitions. ADHD is accompanied by various symptoms such as disorganization, which is the difficulty in maintaining structure and order in daily tasks and activities. Getting easily distracted, which is losing focus quickly and becoming sidetracked by irrelevant stimuli. Forgetfulness, which is the tendency to overlook tasks, fail to recall information, or ignore responsibilities. Fidgeting, which is the repetitive restless movement or behaviors that an individual displays. Procrastination, which is a habitual delay or avoidance of tasks and responsibilities. Hyperactivity is the excess movement or restlessness and difficulty of staying seated. Inattention, which is the difficulty of paying attention, following instructions, and staying organized. Types of ADHD. There are various types of ADHD, such as inattentive ADHD. People with this type of ADHD have difficulty staying focused, forgetfulness, and disorganization. Other symptoms include daydreaming and getting easily distracted. Hyperactive impulsive ADHD. People with this type of ADHD tend to fidget excessively, talk excessively, and have extreme impulsivity. These people tend to be restless and interrupt others. Combined ADHD, which is a behavioral condition that involves both inattentive and hyperactive impulsive ADHD. These symptoms may vary and affect people in various different ways.
In our first study, we'll cover ADHD in adults. Interactions between attention and working memory in adults with ADHD. Electrophysiological markers N2PC, that's the N2 posterior contralateral for attention, and CDA, contralateral delay activity for working memory. N2PC measures the event-related potentials to study how attention is directed at certain locations in the visual field. CDA, contralateral delay activity, is another event-related potential that is used to know the status of visual working memory during tasks that require the retention of visual information. Brain activity data was collected from adults with ADHD and a control group without ADHD. The method used in this experiment utilized 66 participants. 32 participants were diagnosed with ADHD and 34 control participants who were not. The participants were matched by sex, age, and IQ. The study findings suggest neurophysiological evidence that working deficits in ADHD are partly due to insufficient attentional selection and highlights the importance of attention training to improve working memory in ADHD.
Second study, Spatial Awareness, Alertness, and ADHD in Children. In this study, the researchers dived deeper into the correlation between ADHD and spatial and attention towards the left side of the brain. According to the study, ADHD is said to be present if children show at least 6 of 18 difficulties listed within 2 dimensions of the Diagnostic and Statistical Manual of the American Psychiatric Association. This case study involved an 8-year-old boy, referred to as DA, who was diagnosed with ADHD. He exhibited significant hyperactivity and attention difficulties. He showed signs that affected the left side of the brain throughout various different tests, leading the researchers to identify the left side showed signs of neglect when testing both the right and left side, thus showing left side neglect regarding attention. Left side neglect of the brain in ADHD shows not just in the DA, but with children in general may cause and exhibit inattention and attention difficulties.
Correlation between ADHD and spatial attention is greatly affected by the left side of the brain, and it highlights the complexities of attention deficits in individuals with ADHD. Addressing these specific challenges by practicing focused attention can enhance overall function and quality of life. Study findings. Children with ADHD experience spatial bias towards the left side of space when exhibiting inattention. Their spatial bias increase as alertness to their task decrease, making alertness a crucial part in clinical assessments focused on ADHD. These results highlight the lack of alertness levels and take into account clinical assessments, managing ADHD patients, and planning research projects. Final takeaways. ADHD is a developmental disorder that affects people of all ages, characterized by attention deficits, impulsiveness, and hyperactivity. ADHD can lead to spatial biases, particularly towards the left side of the brain, which can enhance attention deficits. Improving attention through training can enhance working memory and overall functioning in individuals with ADHD. Studies show through neuroscientific methods that people with ADHD have deficits in their ability to handle spatial awareness. Our sources are from Science Direct and the National Institutes of Health. Thank you for listening.